Physician-assisted suicide is a controversial topic being talked about across the United States. Those in favor of PAS being legal believe in patient autonomy and mercy for those in pain. Those against PAS believe in wrongness of killing, that it goes against religion, or are concerned about the risk of abuse. PAS is a slippery slope, which makes it such a difficult topic for everyone to discuss.
And stuffed animals. Put the old ginger beer down the sink. Dad always told me, don't you cry when you're down. But Mum, there's a tear every time that I blink.
I'm Dr. Eric Fox. I am an internal medicine doctor at Lankenau Medical Center in Wynwood, PA. I am a first-year resident training / physician in internal medicine. I plan on being here for 3 years, internal medicine residency, and then perhaps specializing after that.
When you have a patient who is sick and dying, how do you go about treating them, since the death with dignity law is not legal in the United States?
So the first thing we do when a patient comes in a situation like this, where they're really sick and in a lot of pain, is we try to get in touch with family to see what their wishes are if the patient can't make these decisions for themselves, which is often the case. If the patient can make these decisions for themselves, there's a whole medical workup that goes in to see if the reason they're in the hospital is reversible or what we can do about it. We initially try to make a goal based on whether we're heading towards getting them better or whether we're heading towards a palliative care sort of end-of-life conversation. And once we strike that, once we figure out which way we're going, when that fork hits, we make those decisions based on that. Usually we'll end up contacting family and having some sort of a family meeting to discuss the diagnosis and the goals of care in terms of what the long-term prognosis are before treating. If the goals are headed towards a palliative care direction, then we'll end up treating the pain. Once that decision is made, we usually use morphine first line for end-of-life situations. There's two reasons. One, it can help with pain, and then a lot of times these people are breathing really quickly. And that's uncomfortable, as you can imagine, for a patient at the end of their life. So the morphine helps them with this tachypnea, or breathing quick, and it helps, of course, with their pain.
She became an internet and television celebrity right before her death this weekend. She said her goal was to begin a national conversation about how we handle the end of life. And true to her word, on Saturday, Brittany Maynard took her own life, using medicine legally prescribed to her by a doctor. She was only 29 years old. She had terminal brain cancer. And the conversation she started indeed goes on.
In thinking about your experience as a doctor, do you believe death with dignity should be legal, and why or why not?
It's a very tricky thing. In an ideal world, I do think that someone should be able to make that decision to say that this is too much and decide that they don't want to go on. I think that's something that should be in place. The devil's in the details. The problem is the logistics. How do you assess competence? We see a lot of cases of patients who have transient changes in their thinking, whether it's from a metabolic syndrome or whether it's just hospital-induced psychosis, where they are transiently making decisions that they wouldn't make if they were thinking clearly. I guess the answer is complicated. It is a yes, that I think it should be allowed, but I think the details need to be worked out.
The Hippocratic Oath states, "If it is given to me to save a life, all thanks, but it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being, whose illness may affect the person's family and economic stability." Do you believe that physician-assisted suicide violates the Hippocratic Oath? Why or why not?
I don't think it goes against the oath. I don't think it does. It's a difficult thing, and I think it's such a good idea for people to know about this. It's a difficult thing to picture when you're not dealing with it each day in the hospital and dealing with end-of-life care. To be honest, one of the best things we do for folks in the hospital is have family meetings. Have family meetings and discuss with their loved ones what the goals of care should be and how invasive to be at the end of life. The standard is to do more. The standard is to do surgeries, to do procedures, to run labs more frequently, and put people through a lot. And oftentimes that's not what's best. It's a case-by-case situation. I don't think it violates our practice.
Our report tonight from our national correspondent, Kate Snow.
I hope my family is still proud of me and the choices I made.
Brittany Maynard made an enormously difficult choice in an enormously public way. In this video posted by an advocacy group last week, she worried the seizures she was having would leave her incapable of making her own decision if she waited too long.
I remember looking at my husband's face at one point and thinking, I know this is my husband, but I can't say his name.
I do believe that if you have an end-stage terminal disease, you should have the right to commit physician-assisted suicide. The person in that type of position is in tremendous amount of pain, and their family, just watching them go through that, it's really heartbreaking for everyone. I can't make sense of why, that should be dragged out. In other cases, such as a person who maybe had an injury and is now paraplegic or had a brain injury, I don't believe in that case, because I think it becomes a really slippery slope. In that case, then someone who is mentally ill could say, my pain and suffering is just as bad as theirs.
When we see our pets in pain, we put them down much more often than our fellow humans. Why is this so much more common in society and easier for us to do when we watch our friends and family in pain? Shouldn't we give them the same opportunities we give our pets so often?
That's a good question. I think that we should. It's one of the worst things we see every day is when some 95-year-old demented patient will come in and we end up doing a whole lot of harm for them and putting them through suffering when we don't know that that's their wishes. Oftentimes these patients can't convey their wishes by this stage of their life in terms of their dementia. It's an interesting analogy though, because what we try to do is make an informed decision based on the patient and their family and as many details as we have. Oftentimes if we can get these family members here and we can get them to see how much suffering there is, how much pain there is, immediately when they see it, they don't want any more invasive care. The problem becomes when these folks are across the country, when these folks are not, they're estranged, when they're not terribly close with these family members. That's when the standard is to do more, and we have to do that legally.
My religion teaches me that only God can decide when a person's life on earth will end. Just because through scientific advances, doctors now have a way to end the life of a person who is in severe pain or brain dead, does that mean that they should act in God's place and do it? Is it the law's place to override God's law by saying it's okay? In the end, it's all about faith and morality. In my opinion, it's better to ease the person's pain with medications and let God make the decision as to when that life will finally end.
She and her family had moved to Oregon specifically because the state allows doctors to prescribe life-ending drugs.
I would like to see all Americans have access to the same healthcare rights.
The 29-year-old's death has reframed a debate defined for so many years by Jack Kevorkian, the man Time magazine called Dr. Death.
He scared people. He was almost like the wild-eyed fanatic. Brittany, she's young, she's articulate, she doesn't frighten anyone, and she's saying, I want my choice, and I'd like more people to have choice like me.
How much is physician-assisted suicide discussed in medical school, if at all? And do you think our lack of awareness about the topic contributes to the fact that there are only a few states where it is legal to take advantage of the option?
It's touched on, certainly. In medical school we focus on the pathology of disease and all that stuff, pharmacology, but it's touched on. We'll answer questions on it and sort of learn what is appropriate and when it's appropriate in medical school. So I do think that there is some education there. I think it's a very, very complicated issue because, you can't reverse it, right? So if you make a big decision like this, There's really no compatible life decision like that. That is the ultimate in decision making, and you can't go back on that. So I think it has more to do with the vast consequences of it and weighing them than it does with education amongst medical people.
I believe yes. I believe the rights of the individual outweigh everything else. I personally don't agree with it. I personally would think that there's way better answers to this life than that. However, provided there's no, all mental issues have been put aside, the rights of the individual to make their own choices in this life is paramount to everything else that could possibly come up. So granted, it's an unhappy answer, and it's something I don't personally agree with, but the rights of the individual outweigh everything else.
5 states allow doctors to write prescriptions to help patients end their lives. 7 more have recently considered so-called death with dignity laws. But Maynard's case also brought out opposition.
Brain cancer sucks in a really big way.
Maggie Carner is fighting the same kind of brain cancer Maynard had. Another advocacy group posted this video before Maynard's death.
It's almost like you've stepped out on a ledge and you're ready to jump. I guess I'm yelling to you, Brittany, on your ledge. I'm asking you to stay with us as long as possible.
And some doctors have concerns too.
The patient has the autonomy to choose how they want to live or end their life. But to ask the physician to be complicit in an act of suicide, I think crosses a line.
Beyond inspiring heated debate, Maynard said her goals were simple.
They mostly do boil down to my family and friends, and making sure they all know how important they are to me and how much I love them.
Maynard may have public opinion on her side. Gallup polls show a majority say doctors should be allowed by law to end a patient's life by some painless means if the patient asks. Whether that translates into legislation is a much more complicated political question, Brian.
Our solution is a bill that sets rules and guidelines for a physician to follow in order to allow a human the right to request aid in dying. The bill outlines the following set of guidelines.
So I'll sing hallelujah.
The physician must confirm that the person is a resident of the U.S. age 18 or older.
When I fell down,
The patient must be competent and able to make and communicate an informed decision to healthcare providers. They also need to be terminally ill, with an incurable, irreversible disease expected to cause death within 6 months, as determined by the attending physician and a consulting physician. The patient must be able to voluntarily express his or her wish to die. The physician needs to ensure that it is an informed decision, which means that the patient has an appreciation of the relevant facts after being fully informed about their medical diagnosis, prognosis, potential risks associated with taking the prescribed medication, and feasible alternatives, including but not limited to comfort care, hospice care, and pain control. The physician must then counsel the patient about opportunities to rescind requests at any time and recommend notifying next of kin. They must stress the importance of having another person present and not taking the medications in a public place. The physician must refer to a consulting physician who reviews the medical record and interviews the patient to confirm the diagnosis. The physician must refer to a counselor if concerned about psychiatric or psychological disorders or depression causing impaired judgment. They will then work with pharmacists to prescribe and get medications. The physician must document all steps in the medical record. Then the physician can sign the death certificate and list the underlying terminal disease as the cause of death. They must then send a copy of the dispensing record to the Department of Health within 30 days. These guidelines allow a physician to know that the patient is competent and is fully aware of the decision they are making. The patient will also be able to die the way they wish. In order to implement this bill, it will have to be passed through both chambers of Congress. We can help expedite this process by teaching people about the subject and enlightening them with the facts about why PAS should be legalized, because every individual deserves the right to rest in peace.
the shape of my mom. You got to see the person I have become. Spread your wings, and I know that when God took you back, He said, hallelujah, you're home.